Welcome back, everyone. Today we're going to be shedding light on what is a medical doctor. So what is a medical doctor? You may ask. Without further ado, without further delay, allow me to demystify the answer to that inquiry right here, right now. Succinctly stated, a medical doctor is a medical professional or a medical practitioner who is able to practice medicine. Of course, the scope of responsibilities will vary from medical doctor to medical doctor, depending upon their credentials, qualifications, skill sets, and knowledge. Specialist medical doctors are able to work in capacities that non-specialist medical doctors are barred from working in, to say the least. So just allow that to marinate into the chasms of your mind. What do medical doctors do beyond practicing medicine? Well, they're able to diagnose and treat illnesses as well as injuries. They can prescribe medications. They can perform diagnostic tests. They can perform surgeries. And they can counsel patients on healthy living behaviors. They can also delegate tasks to healthcare professionals such as nurses, who can assist them with treating patients. The responsibilities of a medical doctor can indeed be ineffably overwhelming to fulfill. Medical doctors can work in a vast variety of disparate settings such as hospitals, private offices, as well as health clinics. The overarching goal of medical doctors is to help their patients to achieve the best possible or optimal health outcomes. Medical doctors should be able to bequeath pragmatic, insightful, useful, practical advice to their patients in order to help them to attain optimal health outcomes. Medical doctors should help their patients to be able to rekindle their health, augment their health, enhance their health, bolster their health, and attain optimal health. Medical doctors should be able to help their patients to remedy any injuries, illnesses, or chronic deleterious diseases that they are succumbing to, experiencing the brunt of. Medical doctors should be able to help their patients to attain robust, vigorous, stellar health. Medical doctors should be able to help their patients to preempt, preclude, succumbing to noxious, deleterious, lethal, hazardous, perilous, debilitating chronic diseases. Medical doctors can do far more than just prescribe patients medication that can provide them with symptomatic relief. They should help their patients to resolve any severe health complications that they are succumbing to, experiencing. They should be able to efficaciously leverage their medical knowledge to be able to help their patients to achieve optimal, desirable, beneficent, salubrious health outcomes. Medical doctors are able to treat patients in a variety of disparate areas. Some medical doctors work in the field of internal medicine as internists. Other medical doctors work as surgeons. Other medical doctors work as podiatrists. Other medical doctors work as oncologists. So the capacities a medical doctor works in, the scope of responsibilities that a medical doctor fulfills can vastly vary from medical doctor to medical doctor. Their overarching goal should always be to help their patients to achieve optimal, beneficent, desirable health outcomes They should aid their patients in achieving robust, vigorous, stellar health. They should be able to help their patients to reverse deleterious chronic diseases. They should be able to help their patients to preempt succumb into ailments. They should be able to help their patients to ward off, fend off, stave off noxious, deleterious chronic diseases. So, they're able to help their patients to maintain their health, or even restore their health. They're able to treat diseases, perform surgeries, and counsel their patients on how to achieve optimal health outcomes. As a medical doctor, you should be perpetually accruing more insightful, pragmatic knowledge to bequeath to patients to help them to attain more desirable health outcomes. Ideally, you want to be a highly competent, highly knowledgeable, highly adept, highly revered, highly reputable medical doctor who is able to help patients to achieve optimal, desirable, salubrious health outcomes. You can help your patients to attain robust, vigorous, stellar health. Then you can help your patients to enrich, aggrandize, improve, ameliorate every facet of their lives, because if your patients have optimal health, they can work more productively, they can function optimally, and they can live more fulfilling, more fruitful, more meaningful lives. If you're ailing, if you're atrophying, if you're waning, then your ability to function optimally is impaired, and it becomes a little more arduous to attain your overarching goals, achieve your higher aspirations, and actualize your latent potential. On the other hand, if you have optimal health, and you're all the more apt, you're all the more poised to be able to attain your overarching goals. As well as reach your higher aspirations and live up to your latent potential. So once again, I hope that you found this video to be insightful and enthralling. Have a blissful day. Goodbye.